All right. Well, welcome to our webinar on building interdisciplinary collaboration, patient-centered care, reducing burnout and improving outcomes. We're excited to have you here and hope that this will be an interactive conversation. Our guests today are Dr. Stiltner of Cardinal Virtues Long-Term Care. Dr. Stiltner, would you like to give us a brief introduction to your background and why you're here?
Sure. Thank you, Laura, for uh, the introduction. I am a board certified osteopathic family physician. I've been in practice for about 20 years. Uh, since I turned out in practice, I've always done long-term care. I am a um, I'm certified as a medical director, so I'm a certified medical director through AMDA as far as long-term care goes. So that helps. It's nice to have that certification, and I have participated in the military for 26 years, mostly in medicine. I also have done family medicine, emergency medicine, along with the long-term care. So quite a broad range there. I've done quite a few things all around the world, but uh, my passion lies with long-term care, and that's why I started my business.
And maybe before I turn the baton to Ryan, could you explain the name of your organization, Cardinal Virtues, and why you chose that name?
Yeah. So cardinal virtues. My wife is my partner in the business, and she kind of come up with this. But it's just looking at the virtues of medicine, the cardinal virtues of medicine, and centering our company around living up to those virtues. To make sure that we're doing things that are appropriate, and putting the patient first, front and center.
Thank you. Yes, noticed that those cardinal virtues are prudence, justice, fortitude, and temperance. Those are all great virtues. Ryan, thank you so much for being here. We're super excited to have an in the trenches leader talking about the care that you provide and how you provide it. Would you mind giving us a little background on how you come to be here?
Sure. Thanks, Laura. My name is Ryan. I've been a nurse for going on 10 years. I started my nursing career as a CNA in long-term care, went on to become an LPN after that, and have been an RN now for going on 5 years. I've got a weird, like Dr. Stiltner does. I've done a little bit of everything. I've done emergency, I've done ER nursing, inpatient nursing, but my heart kind of lies with long-term care. It's where I always seem to come back to. It's kind of my passion. That's why I kind of stick with long-term care.
Excellent. Thank you so much. It's great to have people who are committed and gifted as you and Dr. Stiltner are. So I'm Laura McKee, and I'll be acting as your moderator. I'm co-founder of Hucu, which is short for Huc Cure, Care Anywhere in Latin. Hucu is patient-centered, intelligent communication designed to help people like Dr. Stiltner and Ryan. I've spent more than 15 years in post-acute care, being founding CEO of Autism Home Support Services, and then working with Asif Khan, my co-founder, who also was the founder of CareMerge, to launch Hucu in 2020. We are excited to be working with innovative post-acute care providers like Dr. Stiltner and the Riverview facility where Ryan works, because we're really committed to helping make their lives easier. We're now supporting more than 600 facilities like theirs across the country and are really interested in hearing about the work that you do and how you do it and how we can make your lives easier. So our learning objectives for today are to discuss how interorganizational collaboration is truly the key to efficient and high quality care. None of us are as good as all of us. So how do we build that team across the organizational boundaries that are always present in post-acute care? And secondly, we really want to get practical tips for how to work in post-acute care roles that are often very difficult and geographically dispersed. You're working under difficult circumstances with lots of competing priorities. So, how do you work effectively with your partners in medical directing, the nurse practitioners who are consulting with the skilled nursing nurses, and the nursing team as a whole? How do you work the most efficiently and effectively together? So we're going to go through several discussion questions and get Dr. Stiltner and Ryan's perspectives on each of them. So the first question I'd like to pose to the two of you is, what are the biggest challenges to delivering great care in long-term care? Certainly you face a lot. What do you feel are the biggest challenges?
Who do you
Dr.
want to
Stiltner,
go first?
take it first.
Yeah, sure. Okay. So challenges in long-term care. Well, there are many, and they're all opportunities. I would say that some of the larger challenges are in uh, communications. Obviously, that's why we're having this conversation. But in reality, the communication is always one of the most challenging aspects, and that's communications between providers and nurses, providers and administration. Also, provide between the staff members themselves and the providers and the nurses. So there's multiple individuals that that play roles in this long-term care process. We have social services, we have laundry, we have dietary, we have maintenance, and just having everybody communicate to take care of a patient. It's just like they say about kids. It takes a village. So it really does take a village, and getting that village to communicate together and all be pulling in the same direction is quite the challenge. And that's the challenge that I have as a medical director, and that Ryan has as a director of nursing. That just that's our job. Our job is to facilitate those communications between the individuals and make sure that everybody's pulling in the same direction, so that we can enhance quality measures, so that we can deliver quality care to the patients. And I could go on and on with this. Ryan, what do you think?
Um, agree wholeheartedly with you. Communication is one of the most, if not the biggest challenge that we face every day in long-term care. It's not just communication between the residents and staff. It's communication between the families and staff. It's communication between the different departments. You know, in my hospital background, you really didn't have to worry about that, but we work in these residents' homes, and that's what's different about long-term care. And I think that's what makes long-term care more challenging and more special, because we have to learn to work where these residents live. We don't work in a business, we work in these residents' homes. And I think that's where great communication is so important, because it's a multidisciplinary team all the time working on stuff. You wouldn't think about laundry in the hospital so much. They're much more unseen. But here, oh, this resident lost a blanket. We need the housekeeping supervisor to help us find that. We have therapy that we work very closely with, to help us provide that interdisciplinary approach. And it's imperative. We will fail if we don't have effective communication between all the departments going on.
Thank you so much for pointing that out. You're absolutely right. When you're working in someone's home, there's just a lot more variables than if you were working in the pristine, sterile hospital. So, second question. What is your practice doing specifically to build great interdisciplinary teams? You both talked a little bit about communication. What types of communication are supporting that teamwork?
Ryan, I'll let you go first.
I think, especially in my facility, it's all about, keeping the lines of communication open, We in upper management need to make sure that we are, readily accessible and nobody's afraid to come to us. It's so important to remain in good communication with not just your staff, but your family members also for any kind of, we don't want to use the word complaints, but, we want to make sure that everybody has an enjoyable stay and make sure that everybody feels comfortable with their loved one being cared for. So I think the collaboration between, the different departments, between therapy, housekeeping, social work, activities, even that's everybody's favorite department in long-term care. So we have to make sure that we all communicate effectively to best meet the needs of the residents.
Absolutely. There's a little saying, you want people to stay in your lane, but you want to be able to reach across the lanes when you need to, right? So,
Exactly.
Dr. Stiltner, can you describe a situation where you saw some really great interdisciplinary collaboration?
Oh, it happens every day in the long-term care setting. I mean, just great example is someone's lost a sock, and you need to you need to find that sock. Not only does it take the nursing team to look for it, somebody has to roll the patient and move them so that we can see, is it under the patient, is it in their bottom of their bed, something like that. Then you've got laundry that looks for it, dietary wonders, hey, did they put it on their plate and leave it? Because patients will do that. They'll do all kinds of fun things. So, those are the interdisciplinary things that happen. But when you get into how do you communicate between all the different places, it's one of those things that having a platform that is important to use or that everybody can use and understand and that's intuitive is a great way for people to communicate. We utilize the Hucu app and in our facility, and everybody's on that app, so that if something's going on in the patient with a patient, we all know. We can all be chiming in at the same time. We get the messages at the same time. Everybody's aware, from the administrator to the DON to the provider to the nurse taking care of the patient to social work. Everybody's on the app, and because they're on the app, they and signed in with them, we everybody knows at the same time. Now you don't get overloaded. You only have the app on while you're at work. Otherwise, it's a 24/7, 365 type of thing. So while you're not at work, you can turn the app off, and that's you just sign out and do your thing. But that communication, being able to turn that app right back on, and all the communication that happened while you were not at work is right there, so that you can go through it and say, oh yeah, Mrs. Jones, I remember she needed XYZ, and here's what we did for her. And oh, by the way, here, let me throw in this message about what I experienced with Mrs. Jones. And it's everybody working together. And so utilizing that kind of communication is very helpful in providing that quality care. The patient does, they forget things, obviously. A lot of them have dementia, and being able to articulate to them what they said, because it was communicated directly, and go back and show them, look, this is what you said, this is what the nurse said, and being able to show it to them on the app. Sometimes they're like, oh yeah, I did say that. And so you can use those things too. So plus the app uses video. So if the doctor wants to communicate with the patient, and the nurse is right there, and the nurse says, hey, this rash just looks kind of, can you take a look at this for me? And then we got a video right there, through our app that we can do and see them, or we can take a picture of it. The great thing is everything's HIPAA compliant as well. So we don't have to worry about, oh, did I give Mrs. So-and-so's name or Mr. So-and-so's name? You don't have to worry about that, because it's HIPAA compliant. The app's not going to allow that to be taken off of the platform. It's all web-based. It doesn't stay on people's devices. So, that's how we support people on a day-to-day basis, is by just, you know, having that integration and working together and using a good platform that helps us integrate.
Well, and that's, the nurses are really the heart and soul of any long-term care skilled nursing organization, and they really do deserve, the support of everyone. How do you support your nurses, Ryan, on a day-to-day basis? What's the best way to make sure that, they're encouraged and providing the best possible care?
I think as an assistant director of nursing, supporting my nurses is not, if not the most important part of my job. Can sometimes be one of the more challenging parts, but for the most part, it's okay. Um, I try to do that by making sure that they feel like they have all the tools they need to complete their jobs on a day-to-day basis. Not to let them get overwhelmed, be there to step in and support, whether that's provide guidance, whether that's get in the trenches with them and go down and answer call outs, give medications, administer treatments. And it's not even just about that. It's if my nurses don't feel supported, then they lose that little bit of confidence that they need to be successful in their job. And sometimes you run into the harder conversations that you have to have with families in long-term care. It's not always that, Mrs. Adams is going to get better. She's going to go with therapy and go home. Sometimes you have to bring up the harder conversations. This may be towards the end of her life. What do we need to make sure that not only the resident is cared for, but her family. And I think that especially my newer nurses, that's where they need the support, but behind not just management, but the whole interdisciplinary team, provider, facility, every department to make sure that they have what they need to make their career successful and their day to day, and the residents get the care that they need and deserve.
That makes so much sense, Ryan. It's really important to remember, the level of humanity, that you're dealing with, and the fact that you often are dealing with very vulnerable residents who are nearing the end of their lives. And, that can be difficult for nurses to deal with every day, especially when the families are feeling a lot of emotion. So to have, that level of activity and the level of emotion that they might be surrounded with, they need to have the support of their supervisor. So it's great to hear that that's how you support them. And it sounds like you support them every which way, from hands-on help to education. And all of that is really reinforced by having access to communication.
Absolutely.
So we've got a quick poll to do here.
I know
If,
another thing to
oh yeah, go
support,
ahead.
another thing to support the nurses is just bring food.
Yeah, always.
But
So
long-term care nurses are entirely food driven most of the time.
Yes.
all the major food groups, donuts, pizza,
Yeah.
and coffee.
Yeah. Sorry to interrupt.
No worries. We'll go ahead and do the poll. So the question we like to ask is, which of the following are challenges that are interfering with high quality care in post-acute care settings? So if you're a post-acute care nurse or administrator or provider, which of these are the biggest concern that you have? If you had to call out one, or, do you feel that all of these are issues that need to be addressed? We'll give it just a minute for people to respond. And if we have enough answers, we will flash up the answer. Okay, we'll just keep moving. So the next question is, what practical techniques do you use for quality communication? So in the old days, it was fax and phone and email and sticky notes. And of course, there's no substitution for face-to-face, but you really can't clone yourself so that you can communicate in face-to-face everywhere all the time that you need to. So what's your practical approach for communicating? Ryan, do you want to
So
take the first shot? Oh, go ahead, Dr. Stiltner.
I was just going to say a lot of the communication is just being present. Being present either physically or virtually, meaning through telephone, through video, through app, whichever way, but being there and being responsive. What practical techniques do you use for quality communication? All of them that are practical, whatever the situation demands at that moment. We use all of them. So I don't think there's one specific that stands out, but they're all used together to provide that quality care. So being able to use and have platforms that can utilize multiple um, avenues is helpful. Ryan?
I think you are exactly right. In my job, we rely heavily on, now between office work, it's mostly email.
Uh-huh.
And I do use email sometimes to communicate between the different resident family members that maybe live out of state or on different time zones with me. That it's not, very easy to pick up the phone. I've got a family member that lives in California, and I can't always just pick up the phone and call because I've called her at 4 o'clock in the morning by accident one time. So um, she wasn't very appreciative of that. But um, I think that Dr. Stiltner hit the nail on the head, having a platform that lets us communicate not just with the providers, but with the different departments that all make up the interdisciplinary team in long-term care, to let us reach out, and it kind of provides maybe that level of accountability also. It's a record that, we did. We we can go back and relook at it in the mornings. We can pull our app up and go, this is what happened. We need to do this, this, and this. It's kind of a reminder. Oh yeah, I need to do that today. But we use telephone, we use fax, we use email, but we are strongly relying on our app too, and it's a wonderful thing.
What proportion of your communication goes through Hucu these days, Ryan?
I would say 50% or better does.
Okay.
Absolutely. Yeah.
What do you think, Dr. Stiltner?
At a minimum 50% or better. And and it's not just I have multiple nursing facilities, and it's not just his facility. Multiple of my facilities have used the app, and as Laura already knows, but but it's definitely well utilized.
And how do you achieve your team goals? What types of goals are you focused on with your team, and what are your strategies for achieving them? Whether that's reducing hospitalizations or increasing your census, how do you achieve your team goals?
Well, I think our goals fall in for Ryan and I. We focus a lot of our attention on quality measures, and so one of the things that can happen is we can have that app, and let's say the nurse says, "Hey, Mrs. So and so says that she has a urinary tract infection. Can I get a UTI? Can I get a UA on her?" And well, that doesn't quite meet the goal just because Mrs. Jones says that she has a UTI. That doesn't meet the criteria for getting a UA. So the provider or the DON or whoever's trying to manage those quality measures to get to those goals, it will jump on there and say, hey, is the patient having pain? Are they having blood in their urine? Are they having a foul smell? Are they running a fever? Those kind of things, the things that meet criteria, that prompts the nurse to go back and ask the patient and say, hey, are you having this and that or the other, so that we meet our goals. And then just heading those things off at the pass. So once we get that information and we use that type of stuff, we can prevent a patient from having to go to the hospital. So instead of, once you have all that information, then the doc can see that, and the doc can go, hey, yeah, they need an antibiotic. And so he can send the order for the antibiotic, and now the patient's getting treatment, and they never had to go to the ER. So reducing your hospitalization, treating the patient timely and appropriate, and making sure that we're reaching our goals, in standards of care and quality measures. So, I mean, there are a lot of ways to reach those goals, but having that timely communication really helps. That real time communication.
Ryan, do you want to talk a bit about how you achieve your team goals?
Basically, going to mirror Dr. Stiltner on this a little bit. In long-term care, one of our major goals is, being compliant with regulations.
Mm.
And those of us that work long-term care know there are a laundry list of regulations that we have to adhere to. One of those that we were focused on here recently was the return to hospitalization numbers. Having access to a multidisciplinary app like Hucu, it enables us to have more real-time communication with our providers, not just Dr. Stiltner, but the nurse practitioners as well. We can update that in real time. Say a resident is sent from the hospital on a medication that we're not sure or not they should continue with, or we need a clarification. We don't have to call the doctor, wait on them because some doctors are busy too, like Dr. Stiltner's an ER doctor sometimes. So, we don't have to wait on him to have a lull in his shift to have the time to call us back. It's more quick and efficient communication. It streamlines everything, and we can get the clinical answers that we need to best treat the resident then as well. And that also helps in things like, falls. That's one of our big quality measures. We want to make sure that these residents are safe. Having access to the central supply there on the app. Can we get a scoop mattress placed on this bed now because it's a fall intervention? Can we have a mat placed in this room because it's a fall intervention? Then having the option to, the DON can review that. The DON can look at the numbers and find and identify areas of concern. And then we also have real-time access to our providers should we need them. Say that, the resident had a fall with an injury. Not that we ever want that, not that that's our worst nightmare come to life, but we can get that resident quicker help because we have an app that we always reach out to a provider on. The old days, it used to be leave the provider a message, and when they got it, they'd call you back, and it could be, 30 minutes, an hour sometimes before you heard from anybody. But now with a streamlined app like Hucu it lets us care for the resident quickly and effectively. We know what's best, and we can provide the best care as nurses that we can.
That's fantastic. That sounds like you're dealing with so many challenges from, making a call about whether to get a urinalysis order and, what the requirements are for that, checking the medications, managing falls, managing equipment to avoid complications. It sounds like you're being more proactive and getting responses from your medical director faster than ever.
Yes, absolutely. I would agree.
So that might be a good segue to the last question, which is why do you use Hucu? So you mentioned earlier you have lots of different ways of communicating. Why are you using Hucu, and why are they using Hucu the majority of the time?
I think my nurses, it's easier for them. It's a streamlined communication app. Hucu offers a lot of advantages. We can send files over the computer, and it's completely HIPAA compliant. We don't have to worry about, did we have a release for this to send this way? Did we get permission for this to send this way? Did we get this? Did we dot every T and cross every Q like the regulations say? It is entirely HIPAA compliant, and it lets us stay in more constant communication with not just the providers, but with the whole facility. And it's nice, especially as an assistant director of nursing, I'm not in the building 24/7, but it's helpful for me to understand what happened, not only on my unit, but in the entire building when I'm not here. So when I log back in the app in the morning, there's a history laid out for me. It'll tell me what conversations I haven't seen yet. It'll tell me what I need to look at. It will, kind of draw my attention to, oh, that wasn't there yesterday. There's the flag feature, which I love, that lets Dr. Stiltner and the nurse practitioners, I can mark things as urgent that I need them to look at quickly. I can mark things that a prescription's needed. I can mark an admission. I can mark a discharge. The common things that he needs to look at for me, or I need a provider to look at, I can always tag them. It notifies them, puts up a notification on their phone, and they can do the same with me. If Dr. Stiltner needs me to look at something, he can tag me in it, pops up on my phone, and it's not so distracting, but I know that I have to look at that. And it's kind of, we're getting to the generation of nurses that they have their phones on them. Why not use them? And I think sometimes it's a little intimidating to speak to a medical professional over the phone, especially as a newer nurse. You're always terrified to call the doctor because he's going to scream at me, or he's going to think that, he's going to ask me these questions that I don't know the answer to. But with Hucu, especially if you're asking him about a resident that we've communicated about before, the entire history is laid out there for you. And it's easy to text the information, input the labs, input, what you need help with. And I think that would give the providers ease and peace of mind that, this is what's been happening with this resident. Even if they're not really familiar with that nurse, they know what the resident's history has been, what's been going on. And it really kind of helps tie everything together. The entire resident's care is based in their channel, not just with the providers, but everybody's kept updated with each and every resident, and their kind of stories kind of lined out for us.
Thank you so
And
much for describing that. Go ahead, Dr. Stiltner.
and you can sleep text with it, so
Yes.
when you do get that late night call, because I take all the calls, just that's who I am, that's what I do. So but if you have to wake up, you're not, that nurse isn't waiting on you to wake up, while they're on the phone and hear you halfway snoring while you're trying to talk to them. You can spend that time, you can carefully give yourself some time, wake up, read the message, and answer them back. And they never have to know you were snoring. There are some questions and answers that have popped up. Can we go over some of those, Laura?
Yeah, let's do. Is there one that you'd particularly like to answer, Dr. Stiltner, or I can call them out as well?
I'm just seeing a few here. One of them is it says many HIPAA compliant apps have everyone in one group where they are messaging about all the patients. This may not be HIPAA compliant based on the need to know basis, and we have seen that it creates more confusion. How do you solve this problem? Well, that one's really easy with this app. Because in the app, you're communicating about each individual patient. They each have their own channel. And so you don't have to say, well, was that message about patient XYZ? Because it's only in that patient's channel. So there's not a lot of confusion. You don't have to search back through and say, oh, that was about Mrs. Jones. This was about Mrs. Smith. This was about Mrs. Franklin. You don't have to go through all that. And also you can prioritize the app to where, you're dealing with the things that are most recent, or you may deal with it by hallway or by name or whatever you need to deal with it. So it cuts down on a lot of the clutter, a lot of the how do I find things? It's really, really simple. the things that are in the background that are never used get archived, everything, and you can always go back to those and pull them. But the things that are that you need right there are right there at your fingertips and easy to get. So that, and also on the backside, we can look at who got into that app, who opened that message, who was on the clock, who was not on the clock, who's looking at this stuff, so that if there is a issue, then we can address that. But generally, that's not an issue.
That's great. So I think one of the questions that came up is particularly relevant, because change is hard, particularly in post-acute care. Nobody thinks they need another app, right? How did you get your teams to use Hucu? And, what advice would you give people for launching a new technology?
Can I answer that?
Sure.
I invited Laura to come down and talk to everybody. I brought Laura to my facilities and said, hey, here she is. Ask her all the questions you want. And she was great at teaching them. This is, how Ryan learned, and it was really good. And I think having that opportunity to bring the teams together and learn all about Hucu all at once, and then go out and say, okay, now try it out and let them start using it, just caused it to really, everybody started using it. And once they figured out what was going on, it went really well.
And Ryan, do you have a perspective? How hard is it for you to get new nurses or, maybe temporary nursing staff on Hucu?
Huku is one of the more easier apps that I've worked with. Um, I can very easily go in and add new nurses and give them a real quick rundown of it. It's extremely user friendly, which is nice. Especially, I had some older nurses that, they're not so up on technology as my younger ones are. But everybody's found it very easy to use, very helpful. It kind of walks you through. It will give you little tutorials in the app if you open it and you haven't been there in a while. And just having, it's very easy to get them up and running. It doesn't, I can authorize them to use it for my location and they're up and running. And I think it's really nice for the newer nurses to feel like they can communicate with providers right off the get-go, because so often, in long-term care, oh, well, we'll take 5 to 7 days to get you access to this, and we have to get you access to point click, and we have to get you access to all the different apps. With this one, it's very easy and very user friendly.
Yeah. Yeah. I mean, as soon as a patient comes to the facility, the nurse is able to put that patient directly into Hucu immediately. So if they need something immediately, it can be taken care of. And then, the nurses can be added very quickly. So staff, it's really easy to bring staff on. And then let's say somebody decides that they want to move on into a different career, it's real easy to take them off the app. It's web-based, so it's just really a matter of giving them permission to get in or get off of the app. The other thing that I think is kind of neat, this is way better than it was before, when we had text and phone calls and faxes. Now we have a whole different platform that allows us to do all kinds of different things than what we had before. The other thing that I like about this too is that, like I said, I have multiple facilities, and because I have multiple facilities, I have each one of those facilities listed out in my Hucu. So I just go down, each facility's highlighted. Hey, you've got messages. And then I just click on that facility, and then it gives me the messages that are there. So, I can go through quickly and clear those messages out by answering the questions and giving replies very quickly. So, it's very well organized. It's a quick way to go from file to file and fix that, answer that question and get right back to to the nurse that's taking care of patients. So you get you get a lot of stuff coming at you, but the thing is, it's so well organized that you can go through it very, very quickly as well. So it doesn't take up a lot of your time.
Ryan, have you noticed what the impact on your staff's time is from Hucu?
I think it's definitely been a time saver. It's more real-time documentation. You know, if we noticed a resident that needed something, if we had a problem with a resident, used to in the old way, we'd have to leave the resident, we'd have to go to a phone, we'd have to make a phone call. You know, with the app, you know, the nurses have it on their phones, the nurses can access it on the facility computers. Some of them, you know, they can, so they don't have to leave the resident, they can type a quick message right then, you know, or, you know, even say a resident has a rash, let's use that example. It's very easy with Hucu to snap a picture of that rash, so I don't have to try to describe it, because everybody describes things so differently, and it's never, and as a clinician, you know, Dr. Stiltner has to know the particulars of it to make the correct diagnosis and give the appropriate treatment. So it saved us a lot of time and made it better for the residents, because we can provide more clear, concise information in a lot more timely manner than what we used to be able to.
1,000 words, isn't it?
Yeah, it saves a
Oh,
lot of phone
absolutely.
calls too. Because I would say that, you know, our use of phone calls has gone down dramatically. Not that I don't want to talk to the nurses, but just now they're calling me about those things that are significantly important and timely. You know, a patient's fallen, they've got a broken bone. They know it's broke. I know it's broke. They just need that order to send that patient out. You know, and so they can make the phone call. But you know, if you've got a patient that had a fall, no injury, doing well, they can just put the message on the app, and it reduces a phone call. They don't have to call me. They've notified me, and they have a record of when they notified me, and they have a record of when I responded. So that, you know, if I'm being slow in response, then I would answer to administration as well. So, you know, it's a good way. It's a great way of keeping track of what's going on. And phone calls, you can't keep track of what somebody said, and you don't know what's going on. You don't know what that order was. But by using the app, we're able to keep track of those things exactly. I can give a medical order, and they can see exactly, okay, Dr. Stiltner said 25 milligrams, not 25 micrograms, or something like that. And so just reducing medication errors, or reducing pharmacy errors, all those things that come along with phone calls are important. And so that helps. This helps a lot.
So that level of transparency and accountability and the ability to report on that, it really supports the quality that you're pursuing.
Correct.
Oh, great. Well, that was a great conversation. I know we've taken quite a bit of your time, and your time is very precious when you're serving those residents. So, is there any last thought that you'd like to share?
If anybody, Lori, feel free to share my email if you want. And if anybody has any questions about Hucu, and they want the doctor's advice, I'd be more than happy to have a discussion with anyone.
Thank you so much. We're so appreciative of your time and your willingness to support us. We hope that we're supporting you with as much energy as you're supporting us.
You are.
All right. Well, Ryan, Dr. Stiltner, thank you so much for taking your time today. We really appreciate all of your insights and comments, and we'll keep in touch. Have a great rest of your day.
Thank you so much.